Hello, I'm Adrian Richards, I'm a plastic surgeon, and I'm going to talk a little bit today about the different types of facelift, because there's an awful lot of different types of facelift, and often it's very confusing for anyone who doesn't have any specific knowledge about facelifts to really understand the different variations. Okay, so the way I like to think about facelifts is they're either divided into short scar or full facelifts. Okay, so a short scar facelift is often known as a max facelift, which the acronym stands for minimal access, which basically means short scar, cranial suspension, which essentially means that the tissues of the skin underneath the skin of the face are held up with permanent stitches to the fascia in the temple area, which is very firm. That's the cranial suspension area. Okay, so a facelift can either be a short scar, which typically involves a scar in the hairline here, hidden and in front of the ear. So in any face or neck lift, there will be an incision in front of the ear. Okay, where a short scar facelift differs from a full facelift is a full facelift involves a further scar going up in the fold behind the ear and back into the hair. Okay, who would benefit from a max facelift, short scar facelift? Well, typically these are patients who are younger, normally in their 40s, early 50s, who have some facial aging, some facial descent, but their neck is not significantly loose. Okay, so that's a short scar, max facelift, incision just in the temple, in front of the ear, but no incision behind the ear. Okay, a full facelift is used for people who are slightly older, say from 55 or 50 upwards, who have some degree of neck laxity. And the reason for that is that what we need to do is add a vector backwards in this area to pull the neck backwards and to tighten the neck tissue. Now, often in patients who have a significant amount of laxity in the neck, we'll also add an incision under the chin to tighten up the skin in that direction and often repair the muscle in the neck, which is called the platysma muscle, which separates slightly. Okay, so we're going to talk much more about facelifts in further videos, but the main thing to think about is in the younger patient who's just got some brow descent, some facial descent. The cheeks are slightly lower than they were, so the prominence of the cheeks is more down here than up here. And then just beginning to use some definition of the jawline, a max facelift, which essentially does this, is most suitable. Okay? And that's for patients typically 40s, early 50s. Okay? Patients older than that, over 55, will typically benefit from more of a full, more traditional facelift, which is a face and neck lift with a posterior extension, which elevates the face but also tightens up the chin. And you need to discuss with your surgeon whether they feel a submental incision is under the chin would be beneficial. So I hope that clears up some of the issues. I'm going to talk in later episodes about the SMAS lift and what exactly is done to the lower tissues, the deeper tissues in the face, some of the risks of surgery, and the other procedures you can have with facelift surgery, such as facial peels, fat grafting, and eyelid surgery. So I hope that's cleared up some of the issues. If you would like to listen to a podcast of someone who's had this procedure, please go to our podcast page where I interview some surgeons who talk about this procedure and also some patients. And if we can give you any further information, please contact us and we'll be more than happy to answer any of your queries. So thank you very much for listening.